With October being Breast Cancer Awareness Month, we wanted to take some time to talk about screening guidelines for women, as well as treatment options for those diagnosed with the disease. This morning on Ask a Specialist, we're talking about what you need to know with Dr. Ashley Marumoto, breast surgical oncologist with the Queens Medical Center. Doctor, good morning. Thanks for joining us today.
Good morning, Christine. Thanks for having me.
First of all, what are the current screening guidelines for breast cancer? Because there are some different guidelines that women might hear about.
You're right. Sometimes different ages get thrown out, but the majority of societies recommend that the average risk woman begin screening mammograms annually at age 40. This will be earlier for patients who have a strong family history of breast cancer, or who've been exposed to certain things like chest wall radiation, or who might have a genetic predisposition, like have a BRCA mutation. But for the majority of patients, they can begin screening mammograms at age 40.
And then until what age should they continue with those mammograms? And, if you're in a higher risk category, do you start earlier? Do you have to do it more often?
Exactly, yeah. So the screening guidelines recommend at least until the age 75. And then at 75, it becomes a discussion with your healthcare provider. Now, here in Hawaii, we have a very different population than the mainland, so I even screen a lot of patients up into their 90s. In regards to earlier screening, if you have a family member that has breast cancer diagnosed like in their 30s, you definitely want to start before the age of 40. So talk to your healthcare provider, because we can certainly tailor and personalize those screening guidelines based on a patient's risk.
All right, very important to know. Now, the next question, doctor, is very important for women who'd like to have children. Can a woman with a history of breast cancer still safely get pregnant? And then if so, how soon after?
Yeah. So this was a question that existed for a long time, and there was a lot of concern about pregnancy after a breast cancer diagnosis. So a study was actually published in May of this year that showed that it is in fact safe for a woman to become pregnant after a breast cancer diagnosis. So for women who have had a hormone-positive breast cancer and get treated, and they're on anti-endocrine therapy or treatment for 18 months, this study showed that it's safe to pause treatment for 2 years. And that 2 years was chosen so that it allowed a woman to attempt getting pregnant, be pregnant, have the baby, and breastfeed for a certain period of time, and then go back on their treatment to finish the recommended course. So that study showed that even with the pause in treatment, there were many successful pregnancies, and there was no increase in the risk of developing cancer afterwards.
All right, that's very positive news. And finally, does the type of breast cancer impact treatment options for a woman?
Yes, so there's been significant developments in the last handful of years, and especially in the last couple of years. There's different types of breast cancer, and that's important to discuss with your doctor. You can have a hormone-positive breast cancer, a triple-negative breast cancer, or a HER2-positive breast cancer. And the type of breast cancer that you have determines what type of treatment you're going to get. Also, it's important to remember that some types of breast cancer are more responsive to chemotherapy. Sometimes chemotherapy is even given before surgery if it's indicated. And the importance of that is that allows your team, your breast cancer team, to see the response of the therapy before you go into surgery, or after you go into surgery. They can use that pathology and then tailor your treatment in a kind of response-guided way to see how your tumor is responding to the type of treatment you're getting. And then your doctor can tailor the next therapy. Should we change it up? Should we keep giving the same thing? Is it working? So it's really becoming a lot more personalized depending on the type of breast cancer that people have.
I think some people might think that there's only one option or two options available, but good to know there are multiple options out there for women.
Absolutely.
All right, and to learn more about the services provided by Queens Cancer Center, you can visit www.queens.org, click on services, then click on cancer. Dr. Marumoto, we thank you so much for joining us today. Very important topic, and I think it just provides, a brighter spot, more perspective for women out there. So thank you so much.
Thank you for having me.